Today, we have Dr. Navaporn Nalita, MD, FRCST, is an accomplished neurosurgeon, healthcare innovator, and entrepreneur with a powerful mission to transform global healthcare delivery. Beyond her distinguished surgical career and advanced training, Dr. Nalita is the founder and CEO of IDEA, an AI-powered healthcare platform designed to revolutionize clinical workflows and address critical healthcare system challenges. Motivated by witnessing the devastating toll of healthcare workforce burnout, including the tragic loss of overworked colleagues in their 20s, Dr. Nalita left her neurosurgery practice to pioneer IDEA. The platform leverages advanced artificial intelligence and foundation models to automate routine clinical tasks, enhance diagnostic accuracy, and create scalable virtual clinics. By integrating the intelligence of a doctor's brain with cutting-edge AI, IDEA addresses staffing shortages, expands access to quality care, and empowers physicians to save more lives while reducing burnout. Dr. Nalita's work represents a bold intersection of clinical expertise, healthcare advocacy, and technological innovation, positioning her at the forefront of reimagining how healthcare systems can operate more efficiently, compassionately, and sustainably across the globe.
Dr. Takey, how's it going?
I'm doing well. Thank you.
What is the time in Bangkok right now?
It's 9 p.m. in Bangkok right now.
Right. Okay, sounds good. So it's not too late. Dr. Takey, I have witnessed a lot of experience like myself for a clinician who are working in the healthcare setup. Then they decided to make a traditional work. But your story, it's a little bit different for me because you were a neurosurgeon doing, or you did 10 years of experience, which is quite strange. Maybe for me, I don't know. For sure, it's not for you. So tell me more about you.
Yes, my name is Navaporn Nalita, but you can call me Takey. So I was a neurosurgeon for 10 years, and I've been in the medical field for almost 20 years. Right now, I am currently a full-time founder and CEO of a startup company called IDEA. We are building doctor's brain. Basically, what we're doing is that we are building a multilingual, multimodal medical foundation model.
Interesting. So walk me through your process in very high level. What encouraged you to take this step, to leave the bedside or to leave the medicine and go start entrepreneur journey for yourself?
Well, as a neurosurgeon, I constantly saw inefficiency in healthcare. So especially in the rural area, patients often experience delay in diagnosis, miscommunication between like medical terms, and it's a lot of overwhelming administrative burdens that took away valuable time from patient care. So I came to realize that there must be some way or some solutions that help us to tackle this kind of problem. So I think AI could address these issues. I think it's one of the most promising technology that we have invented for a long time.
So are you trying to tackling the issue related for cerebrovascular specialty or overall all the problem maybe the patient they can't?
Overall, I believe that the shortage of staff is a global problem, and it happens with every specialty, every subspecialty as well in healthcare world. So our model, it has been trained on a vast medical data sets in every specialties that there are.
Can you tell me from physician perspective why there is a shortage in the physician?
Mm-hmm.
Why there is a shortage in the physician work force overall? And I believe also this is what you are trying to handle in Bangkok. We are familiar with a shortage in healthcare sector for every sector here in Nam. But about Bangkok, would you please give me more insight why you face this challenge there?
Well, I must say that actually Thailand has one of the best quality healthcare in the world. I think we rank about like top 5 of the best quality care in the world. But however, I think the ratio between doctors and patient is still very, very low. And most high quality cares are treated into the central area of the country. So when you go to like the rural area, yes, you can access to high quality care, but that takes a lot of time and few doctors who are working like relentlessly and like nonstop to provide you the best quality care. So all the workload and all the burden is on their shoulders. So yeah,
So
that's the thing.
this is because there is a misdistribution for the doctor in geographical area in Thailand, or
Mhm.
because there is low supply of physician.
I think it's the mismatch between the ratio between patients and the doctor. So there are crowded physicians in the central area, but in the rural area, there is very low physicians per patient.
When you see the delay in diagnosis
Mhm,
and patient safety concern,
mhm.
which drive you to step down from your practice and build your solution. Currently, is there is any mitigation solution try to take care for all those safety concern, or this is something in Thailand is not considered and you want to build it from scratch?
There has been some solutions that are trying to tackle this problem, but I think that if we have to tackle this kind of problem that is very huge and complicated, you need a very high technology, the technology that can make this complexity into an easier one to tackle. So for example, like one major challenge is the early stroke detection.
Mm.
We have many tools to we try to use those tools, for example the message, the chat in our phone, but none of that truly help us or truly alleviate the burden that we have to face. So AI, I think it can analyze image scans faster than human radiologists. I don't say that they are more accuracy, but I say that it can analyze it faster than the radiologist. It can at least help the intern who are responsible for the case at the rural area to have someone to have some tools to help them detect the stroke. So I think another area is also like the triage or the pre-screening. Like AI can triage patient based on symptoms, like helping doctors prioritize urgent case. And that helps a lot in a very crowded area of patients.
Yeah, I believe that will be case for the ER to utilize this for triage. I never
Mhm.
thought about it, but yes, correct. Uh, why not you as a doctor try to find some provider they offer IT technology provided by AI to give
Mhm.
you the solution? Why you decided to no, I need to step down by myself and do that by myself? Do you think they will not be able to utilize the AI for your benefits, or you see your skill set and expertise is required while you are building the AI?
I think this is a really great question. Well, I have to think it a lot. What I feel is that as a neurosurgeon, I have some basic information about brain, about how brains work. And I see we can see that AI is still like an early process developing. I mean, in the process of building something that is familiar to brain. And that's fascinating me. I don't see AI or I don't see foundation model just as a tool. I see it as the early stage of building the virtual brain. So for me, I see the potentials. Right now, AI might, or foundation model, or LLM large language model, it can predict word to the next word and forming the sentence. But I think in the near future, it can be better than that. Actually, right now it can do some like memory retrieval, and we're talking about AGI. Some are talking about connecting the LLM to the physical AI. We might finally, we might build a virtual brain that we can put that virtual brain into a physical surgery. So that fascinates me. I want to see how far I can do with this amazing technology.
This is maybe will be a concern for a lot of clinicians and physicians and nurses because they started to speak up and say, trust us, don't trust AI. Now you, from this team, you are against what they are believing, and you try to build that AI brain or virtual physician brain and put it on the physical places to do medical practice. So do you think this is will be helpful for the physicians and clinician? And now you will bother them because they don't AI, and you are pushing forward with the AI.
There is for sure a dilemma in this space between the advantage of what AI can give us and the trust issue that we have to be very cautious when using AI. But I have one story for you and to the audience as well. I have a friend who he was on duty for I think like 48 to almost 50 hours consecutively. And he was a very strong man. I say was, yeah, right. So he was a very strong man, very ambitious, and he loved being doctor. So after being on duty for almost 50 hours consecutively, he got an accident. So he drove a car. He didn't have well sleep or enough sleep, and then he died at the age of like I think 27 or 28. And that happens a lot. So we lost healthcare providers, not only doctors, nurses as well, into this kind of accident that we could have prevented from happen if we tackle these problems beforehand. And there is also one of my friends that committed suicide because the overburden that she took, it's more than we could imagine. So as we develop or as we go into the aging society, we will see more patients, less doctors, and the overburden will eventually grow exponentially over time. So I don't think that we can only have some tools to alleviate this burden. For me personally, I think that we have to find some technology that's smart enough to be one doctor to treat the patients. That's my personal and ambitious goal.
Your opinion, but this is okay. This is the evidence was based on what you has stated right now. This is where the AI will replace physicians and nurses, so they are afraid they will lose their job because of the AI. But
I see.
when you started, you put two uses cases. It's very important how AI they can help us, but you end also will replace us. So how we can make the balance between utilize this solution and tool for our benefit and to enhance our practice and also to improve our work-life balance, but at the same time still we have our own job.
I see. I don't think we will reach the ultimate stage of building a doctor's AI that can replace that in like few years. I don't think that will happen in these early years. So I think that there's a wrong look. Okay, let's frame it this way. My company, we have something that we call the acceptance level. It means that each of these level or each of these acceptance level of the model can be implemented in real world. So in the first stage that we are doing right now, we use the medical knowledge LLM to do something that is an easy task. For example, like an administrative task, help the workflow to work more efficient, doing like note-taking stuff, something that these LLM, they don't have to interact with the patients directly. So they need doctors they still not needs a doctor oversight. But as as we continue to develop these LLM to be more clever or to get smarter, then we have to taste in the real world, like in the how do I say it, the limited space, like in R&D process, until we get that, okay, this is safe enough to be used with patient directly. The step is like this.
What does make sense, and this is where the regulatory body they make sure the patient will not receive any treatment or any new technology or any new med or anything until we make sure that during the R&D all the process is tackled and it is safe enough for the patient. So you touch base a good topics here when you started doing your research and your hypothesis. So how you make sure your solution will be market fit and ready to utilize it on real patient? When you expect this to be happen?
Actually, we did. After we have trained the model and we launch it to our pool of doctors, our doctors network, the feedback is it's exceptional. The feedback is really good. Most of my doctors' friends, after they use the model, they don't say something like, "Oh, this will going to replace it." No, they say to me like, "Thank you, I need this." And it turns out they use this model to help them with the medical education. For example, with my friend, they want to outline the how they say the medical education, the course, the teaching course for her students. They use my AI. They use our LLM. Use ID. Yeah. So I think there are many things that we can do with this LLM. It's important for doctors to know how to prompt.
Which is something is not easy. It's hard even for simple tasks. So how you will make sure they will put the right prompt?
How do you make sure? First
Or
thing,
how you can support them to make sure with the minimum training from your side, okay, they will be utilize the tool for their benefit and they will use the right prompt for their patient.
I think this is when the solutions level come in. So we don't only have the foundation model like the raw one. We also have the solution layer and the application layers building on top of the foundation model. So it's very easy for almost automatic for doctor to use. For example, the note-taking one that are building on top of our model, doctors don't have to do anything when using the solutions. They just talk with the patients and the application will automatically transcribe assessment and provide them with the plan of the treatment. And then doctors will be the one who decide which treatment options they want to go with. So I think
Yeah, this is very important. The final call will come from the clinician. They will decide it if they will go with the recommendation or will they go with their treatment. So let's assume scenario and take one use cases when assuming you reach for the application level. So give us end-to-end solution in one use cases to let us understand how this solution when be ready without any promoting how this will support us. If you give us one use cases from your experience or for any specialty you would like to give it.
For sure. One use case that we are going to implement in real world use case with one university hospital that is partner with us is the pre-screening and triage. Patients triage. So instead of patients talking and go to directly to nurse, they can use our chatbot and put in their symptoms, and then the chatbot will try to figure out which department patients need to go to. The second use case, which is the one that personally I love it so much, is the medical education. So we call this one Nightingale. Nightingale is in like AI than Nightingale. Yeah, what we do is that we put this LLM and connect it in with the simulated patients, and these simulated patients can generate questions like 10,000 questions, simulated case, and interact with the medical students. So we don't have to think about how many questions we need to give to medical students. These simulated patients will do that for us.
Yeah, this is the same thing where I consider with my this use cases for education, how we can use technology for professional development and also to tackle the burnout and to mitigate the turnover. This is through my startup Kayan. We consider this right now tackle this for nursing mainly, but in the future maybe we'll consider because we see the value. But now, based on what I understand from you, you are not focusing only on treating patient. You see the whole healthcare system and you consider your solution like medical open AI?
Yes, correct.
You are sharp. You are sharp. So here, let's back for the example which you give it us for the use cases for triage and pre-screening. Do you have any number or any study you have discussed with your client, the hospital, who will adopt it? how this technology will decrease the waiting time?
After we've done some research, and I think the number will around like 20x time less consuming for using these compared to using these solutions.
What do you mean by 20s?
It's 20 times less.
Time less, 20 times
Yeah.
less. So yeah, so now if we take it just to simplify it for the patient, what is a huge number, 20 times less. So currently, what is the average time in the hospital they adapt your solution before using your solution?
Well, normally when we using the admin, it will take around like 20 minutes to 30 minutes for them to get back to the patients, because the person who is responsible for this task normally is a nurse or an administrator, and so when they get the questions, they need to go and ask for the specialist or their senior and then get back. And according to what we have done some research, it will take around like 20 minutes to 30 minutes for one cases. But with the triage, with ID, it only takes less than a minute. So
But
when
you build this assumption like the patient, they are tech savvy, but maybe they are not.
right, sorry, pardon?
I mean, when you build it, this is what take it from the patient less than 1 minute to fill those pre-screening question. Is this assumption built based on the patient is a tech savvy, or it is normal patient with no experience with the technology?
Anyone, you can ask like for example, there's one case, patient say that she has a burning sensation around here. And when she asked with the admin, like the real human, the answer is you should go to see the internal medicine. With ID, the answer is you should go to the gastroenterologist. So it turns out the patient has a GERD, like gastroenterol reflux, like acid reflux. So I think it will take less time to have a pre-screening or pre-diagnosis before getting to talk with the real doctors.
Can you tell me more about your company, how you developed your solution, what is the technology you are using, how many team members do you have, what their specialty, and also tell us about how you build it from fundraising until how you picture it in the future.
Well, one thing that I feel blessed is that before I came to finalize my idea into building the AI company, I was a founder of another company 2 years ago, and it's called Crypto City Connect. The crypto part is not like cryptocurrency, but it's cryptography. So what we did is that we make it as a blockchain and AI academy. So we pool all these talents in tech talents in Thailand and train them. So with this kind of approach, we have a pool of tech talents in our hand that we can work with them. And then we can like discuss and see what solutions that is interested enough to go forward with. This is one step. The second company that I'm building, which is ID. Right now, we have around like 4 to 5 staffs in the company, but we have the outsource and also the pool of talents that are helping us as well. Right now, we are raising funds to build and continue to implement the second version of our model. So this version of model will be a multilingual, multimodal medical foundation model, meaning that it won't understand only text, but it can understand images and voice. And it also can understand many languages. One thing that I think is the advantage of ID is that it's not only focused on English, because I think more than half of population in the world don't speak English. They have their own language. So that's why I think this one thing is the thing that we are very, very focused on. So right now, yes, we are raising funds to continue to do all the training, the model training.
And what series right now you are in? Series A?
Oh no, not yet. We're in seed stage.
Seed stage. Okay.
Yes. The second point that I would like to make is that right now we have partnered with one university hospital in Thailand, which is Ramatipati University Hospital, one of the 3 biggest university hospital in Thailand. Within this year, we're going to partner with at least 5 university hospitals in Thailand to do the R&D process in each of the university hospital, because each one has their own specialty, are good at, each of them has, how do I say it? Each of them is not the same. So they have their own specialty that can help us do all the seed tests for our model training.
Interesting. So are you planning to stay with Thailand, or you are looking to move forward across the border?
Yeah, this is also a question that we have asked a lot. So on day 1, we announced that we are the global startups, meaning that we want to tackle the problem that this world faces. So we are not going to limit it ourselves in Thailand, but we have to start from Thailand because Thailand has a high quality data set, and also many doctors in Thailand are willing to help us fine tuning the model and also test it and implement it in the real world setting. So I think that approach gives me so many advantages by starting from Thailand. But in the end, since the problem is the same worldwide, we are going to push our model, and we want it to help save billions of people's lives. So it must be a global startup.
Where do you see yourself, your next marketplace after Thailand?
We are looking at Singapore for sure. Singapore is very welcome, and I must say that when I went there for an exhibition, I feel blessed. They are very open to innovation. They are willing to help us grow, and they are very active in inviting us to work at the country. And there are also a multicultural, multilingual place. And yeah, correct. So it helps our model training a lot. The second country that we are now looking to explore is Indonesia because of the high density of the population.
Which makes sense. It's all those countries near from you in Asia, and also they have their own specific problem, and it's a good place where to prove your concept before booming globally. I wish you best of the luck in your business idea. I like it. I support it, and it's match with of what we doing in Kayan, and I believe in the future will be a future collaboration together and help you to come to the NAM market, hopefully together. If I want to move forward and ask you, out of your solution, how you see the future of the health overall using the AI?
I see the world that everyone or most of the populations can access to healthcare easily. I think AI will be the technology that democratize healthcare. Another thing that I would love to see is that we shouldn't have to sacrifice doctor humans in making the world better anymore. For example, right now we use doctor human in like the war zone or the what we've called the red zone. If we can build doctor AI that is capable of doing what human doctor do, we can save millions of doctors' life as well.
So, as a final message from you, what will be your messages for all skeptical person and people they are not seeing a real value from what you are doing, either patient or healthcare profession or regulatory bodies?
There is one research that say that we have lost and we could save 75,000 patients' life if we focus more on using technologies to help us in the healthcare space. So I think that when something like COVID-19 attacks, we will see it obviously that we need technology. So I don't think that the only thing that we should be worried is trust. The AI trust. I think that we have to balance with the urgency that we have lost doctors' life every month and every years as well.
Can you, just to make sure I get your messages right now here clear, when you mention we save doctor lives, what you meant by doctor lives? You mean psychological life or a work-life balance? What exactly you are aiming here?
Sure. I think that the workload right now that we are faced is not something that humans should take alone. For example, I think there are like 10 to maybe 100 worldwide of doctors committing suicide because the workload and the stress that they have to carry along the journey of their saving others people's life. The second thing is that many accidents happens every year, and that breaks people's heart. Like many doctors, young doctors die because they don't have any tools to help them to take care of others people's life. The shortage of staff right now, I think it's in a very crisis stage. So for example, one hospital in Thailand, there is only one doctor. Yeah. And other healthcare professionals that are helping them is nurses. So one doctors and maybe like 2 or 3 nurses has to take care thousands lives in their hand. So he has to be on duty like 30 days a month, like 365 days a year.
So mainly will be a good tool and resource for all healthcare professionals to decrease the burden on them and support them with day-to-day activities and with high quality and high efficiency, and also not to burn them quickly. Try to have this as a supplementary resource for them and tool. This is how I understand it. Is this correct?
Yes, it is.
Which is for sure, no one will say no for helping them in their mental status and make balance between work-life balance. So everyone will be appreciated for this, of what you are doing. I wish you all the best and thank you for your time. What do you want to give us as a last message? How you want to close our episode for tonight?
For me, I think changing career is very difficult. And we need a community like yourself, like what you are doing now, to help supporting us. The healthcare professionals, the system itself is a very rigid structure system. When you move from these kind of rigid structure to a more dynamic, more like a free world in entrepreneur space, you need to adjust a lot, and your community will help take all the burden out and also helping supporting each other, which I think is very important.
And we are happy having you in this community, and we're looking forward to collaborate more and expand this community worldwide. And we have same passion and same aim: improve patient outcome and enhance clinician their life. So we are in the same page and looking forward to be in touch and see how we can bring you to us here in the US and in Canada as well.
Thank you so much, for sure.
Thank you. See you. Have a good night. Bye-bye.
Bye. Bye-bye to all.
If this episode sparked something in you, here's how you can keep our mission alive. Subscribe to Uncharted Narratives S03E08. Leave us a 5-star review. It helps more amazing people discover our stories. Share an episode that moved you with a colleague or friend. Connect with me on LinkedIn and join our healthcare innovation community. Together, we're not just telling stories. Until next time, stay curious, stay passionate, and keep pushing the boundaries of what's possible in healthcare. See you in the next episode of Uncharted Narratives S03E08.